Today we're going to talk about the privatisation of the NHS.
And for those medical applicants amongst you, this could be a current issue that you're asked to discuss in an interview here as public. And all citizens pay national insurance and general tax, which in part goes to fund the NHS. Clinical commissioning groups decide how the money is spent, and this is made of GPs, managers and other clinicians. But they can't make decisions on mental health. They cannot commission GP services or specialist services, and this is left to a higher body called NHS.
You can still get free care because when they apply for a visa, they have to pay a fee, and the fee partially goes to the NHS to provide them with free care.
Means the gradual increase of money spent by the NHS on private companies, and currently the yearly total of money spent by NHS England on private companies is £7 billion. And some people fear that this means that eventually there won't be any more free healthcare for society.
Private healthcare. When waiting lists are too long in the NHS, they can pay money to the private healthcare specialists to provide some of the healthcare to decrease the length of the waiting lists. And a shortage of doctors working for the NHS will mean that the NHS pays private doctors to work as contractors.
2012 had an effect on privatisation because it focused on improving community care, and when this act was enforced there was a demand to open more care homes, so many nursing homes were privately opened as businesses. That means
Your healthcare provision is owned by private business, and only the poorest are treated by the state. But in 2012 the World Health Organization ranked the USA as having the highest expenditure on health.
about
Not a debate, is it?
it's a discussion about whether or not privatisation is a good thing for our country.
So here are my points for why there should be privatisation of the NHS. Number one, there'd be less waiting lists for the NHS because more people would be going for private healthcare. More money would still be available for the NHS as people are still paying national insurance contributions. Some private healthcare will be referred back to the NHS, so money won't be lost. There's a choice for patients, so patients will have a choice whether they are going to do private healthcare or going to stay with the NHS. If the private healthcare didn't exist, patients may go abroad for it, and if any accidents happen abroad, then the NHS would have to deal with it here. It reduces time wasting patients because you'd have to pay for your healthcare now, and it would add to how much doctors earn.
However, some people think that having to pay for your healthcare isn't fair on those people who can't afford it, and since doctors are supposed to be altruistic, they shouldn't be providing healthcare for profit. So, is privatisation really a good idea? We hope you enjoyed our video on the privatisation of the NHS. Thanks for watching. Bye!